Let's talk medical trauma. So, as a lot of you know, I'm a family doctor. I have a direct primary care practice. And what I'm finding is I have now a subset of patients who have come to me because they are suffering from medical trauma. And what this means is that at some point they had an interaction with healthcare that left them with traumatic stress. Now, this interaction could have been a negative interaction with a doctor or a nurse. It could have been a traumatic diagnosis, a serious diagnosis. It could have been suffering from chronic illness and having a multitude of negative interactions. It could even be a traumatic childbirth that left them with anxiety and stress and some trauma. So what I'm finding is that it is really impaired their ability to get healthcare when they needed to get healthcare. So some of these patients, even though they are high functioning, they have families, they have kids, they take care of everything, but they're not able to take good care of themselves from a healthcare perspective. So they're behind on their screenings, things like that, because they just can't bring themselves to go see a doctor. And they find me because they've heard about direct primary care and they want a different approach that's less stressful. And direct primary care is really good for that. I can't speak to all offices, but in my office, it's just me. It's not a super stressful process where you sit in a crowded waiting room, you're waiting, the doctor's like an hour behind, you get taken in one room and get your blood pressure, they take you in another room, and then you wait in another room. It's none of that. Like in my practice, I meet the patients at the door, I bring them in, it's just me, it's a calm environment, it's not bustling, there's no waiting, I have my calm little office. We just sit down and there's not a lot of pressure that it has to happen really. Everything's happening fast, in and out. It's way more relaxed and calm. And that seems to be extremely helpful for people who are carrying this medical trauma. And it's good because I can slowly get them kind of desensitized to medical care and really slowly get them taken care of in a more slow process so that it's not overwhelming. And I really, really recommend it. If you are someone who is suffering from medical trauma and knows that you do need to see a doctor, but you haven't and you don't know what to do about it, look in your area for direct primary care. Read reviews, find someone whose energy seems to match